Okay, so last week you heard about my first two chemo cycles, which equates to about 4 weeks total. They were hard, very hard. The whole composine thing nearly wrecked me. At one point, I said to my partner, if this is what chemo is, I can't do it. Thankfully, I had a patient and wonderful provider that figured that disaster out because that meant I was willing to continue on with my next 6 chemo cycles. And another 6 cycles meant about another 12 more weeks of pushing toxic metals into my body. Okay, so let's take a second and talk about take-home chemo because, yep, that's a thing. Because the 4 to 6 hour infusion of toxic metals just isn't enough. So I got to bring Penelope the pump home with me, stowed away inside my fancy black hip sack, and wear her attached to my friend Peter the port. I got a special sun patch sewn onto the hip sack as a reminder that we were using this awful medication to actually spread light into my body, light into the darkest place deep within the walls of my rectum. And so, in a nutshell, take-home chemo pretty much sucks. The fatigue that it creates is unbelievable, and by the 46-hour mark on Sunday, because all of my chemo infusions were on Fridays, I was so ready to get that damn thing off of me. Now, I actually ended up with a few different kinds of pumps because the cancer people weren't happy with the first kind I used. So the second pump seemed a bit bulky to me, but it didn't really bother me. However, after I used this new pump once, the next time they had yet again changed the protocol. They had decided that too much of the chemo was getting sort of stuck in the storage area of the pump because it actually wasn't quite big enough for the chemo bag to fit properly. So guess what they did? They removed the storage area and they had me walk around with a bag of chemo all on its own inside nothing other than my fancy little hip sack. And this is what I was told by my absolutely awesome chemo nurse, Jen, who was also not a fan of this method. Well, the charge nurse took a bag of saline home and rolled around on it. It didn't pop or leak, so they feel that this will be safe. Okay, so I am no doctor, but I am pretty sure that saline is a little bit less toxic than fucking chemo medication. I just remember rocking my 7-month-old to sleep in my arms, which were resting on my fancy hip sack that contained a plastic bag full of medication that would kill her. I did my best to pretend that nothing bad could possibly happen, and thankfully nothing did, but still chemo, people. Can't we do a little bit better than that? Okay, so back to the overall joys of chemo. As I mentioned last week, I kept hearing about chemo symptoms being cumulative, but I really didn't get it quite yet, at least not for the first 3 rounds. However, by my 4th treatment, things started to be a little different because I started to experience the whole idea of cumulative. During each chemo treatment, my amazing chemo nurse, Jen, would ask me a whole bunch of questions about my symptoms. The first few times it was super easy. Nausea, yes, a little bit. Fatigue, yes, a little bit. Anything else? Nope, not a thing. Thought I had this chemo thing down pat. Then lots of stuff started changing and my symptom list grew and grew. I'm not sure which one I noticed first, so I think they kind of may have all started around the same time and got progressively worse. And they were so bad, in fact, that my oncologist had decided to withhold my final chemo treatment, but we'll get into that in a little bit. So just as a quick refresher, the whole sensitivity to cold was definitely a factor, but that also got worse and worse. By the end of August, I was driving to work with gloves on because the morning New England air was just too cold in August. But that was really more of an inconvenience than anything. I think the next thing I noticed were what are called mouth sores. Now, there's this stuff called Magic Mouthwash, which literally tastes like ass, but it helped me a tiny bit for maybe a week or 2. Then it pretty much was useless, and my mouth looked and felt like I chewed on a cheese grater every night while I slept. I also started getting these weird sores on my scalp. Now, these sores are apparently pretty common with the type of chemo where patients lose all their hair and can be treated with topical medication. But with my chemo, total hair loss is pretty unusual and thankfully didn't happen to me. But my super fine, soft baby hair turned into straw, literal straw. I had to use a special oral medication because I couldn't put anything topical on the sore since there was just too much hair on my head. Oh, and my hair didn't grow for months. I remember the first time I had it done about 4 months after chemo had actually ended. I was being interviewed for the Rhode Island Projo and knew that they would be taking headshots. As I sat in my hairdresser's chair, I cried. I cried and said, this is what chemo hair looks like. I never ever wore it down because you could see how strawish it was, and so it was always pulled back, nicely framing my big fat round moon face. So sitting in front of this big mirror, taking a true inventory of my face and my hair was a bit overwhelming. And it was then that I really felt like a cancer patient for the first time. So, moon face. Yep, that's a real thing, a real round thing. And while most people think of patients losing weight with chemo, not me. Nope, no way. They had to load me up with so many steroids just so I could tolerate the treatment that I literally just ballooned up. And I'm not talking about a little bit of weight gain, I'm talking about 40 pounds in 2 months. 2 months. I even had a woman in my office pat my belly and ask me if I had some exciting news to share. Nope, I didn't punch her in the face, but I definitely had a word with her about calling someone fat. But back then, my cancer was still a secret. Oh, and I also developed acne on one side of my nose only. It was so weird, and it went away about 4 weeks after my final treatment, all by itself. And the last really fun side effect, which I will likely have forever, is very significant neuropathy in my feet. That first winter, I was afraid to walk across the parking lot because I couldn't feel my feet at all. And when trying to navigate ice and snow, having no foot awareness is nothing less than terrifying. My feet are better now, but I may never be able to wear flip-flops or walk barefoot in the grass again. And I have to wear the thickest socks possible all winter because even though my feet may be sweating, they feel painfully cold to me all the time. Okay, so now back to chemo treatments. My 7th cycle was on October 11th, 2019, and it was a blur. I, of course, brought my laptop along with my good intentions of getting lots of work done. I'm pretty sure I even opened my laptop bag up, but I don't think I looked at it. I don't really think I looked at anything. I'm pretty sure I spent 4 hours just sort of sitting there staring into empty chemo space. My brain was cooked and I was dazed and I was exhausted. And I didn't even know it until I got home that night and realized I had literally done nothing the entire time I was there. Okay, so all of this fun stuff was happening from cycles 3 to cycle 7. I had no idea my symptoms were considered atypical because, I mean, what the hell did I know? I'd never had chemo before, so I figured all this stuff was just par for the course. Then between my 7th and 8th cycle, my oncologist had me get an MRI on October 18th, 2019, so that we could see what was going on with Clancy, my rectal tumor. Dr. Breakston wanted to see how effective the chemo had been so we could continue to make appropriate treatment decisions after chemo was done. On the day of my 8th and final chemo treatment, October 25th, 2019, I went into the Fane Center just like I had been every other Friday for months. Only this time when I met Dr. Breakstone, she said she had a present for me. She said that she was going to withhold my final treatment. She did this for 2 reasons. First, my side effects were considered so bad that she was concerned about what one more treatment would actually do to me. But the other, more exciting reason was that there was no evidence of a tumor. Now, that didn't mean I was labeled cancer-free because, as I was told over and over again, all it takes is one little cancer cell. And since nothing had been biopsied, I had not reached survivorship status yet, but that would indeed come later. So I not only got to skip my 8th and final treatment, but I got to spend the rest of the day doing nothing. And it was so, so lovely because I was so, so tired. And that's the end of chemo for me. I hope if nothing else happens as a result of you reading or watching or listening to my story is that you make sure to get your colonoscopy as early as you possibly can. The age has been lowered from 50 down to 45 if there is no known family history. And I also hope you remember that you have the capacity to mine your light even in the darkest of circumstances, and that you deserve it.